Welcome to Neo Fertility, advanced fertility care through cycle tracking. Our logo reflects the 4 phases of the menstrual cycle: bleeding days, dry days, mucus indicating the window of fertility, followed by dry days again. Neo Fertility provides comprehensive fertility awareness to help you either achieve or avoid pregnancy. We use 3 key indicators: bleeding, mucus, and, if needed, temperature. Data from the fertility chart is essential for women's health, family planning, and Neo Fertility treatment. We have a team approach to fertility assessment and treatment. The doctor prescribes, you, the couple, follow our treatment plan and are supported by the Neo Fertility Advisor. The Fertility Advisor teaches you how to observe and record your signs of fertility accurately. She supports you during treatment and is an integral part of our fertility team. The Neo Fertility chart can identify signs of impaired fertility, can assist with the timing of fertility investigations, and monitor the progress of treatment. The chart can let us know if treatment is working or if we need to adjust our plan. You will get to know our reception team very well. They are actively involved in your care to discuss monthly blood test results and convey medical advice from your doctor. So, how effective is Neo Fertility? Published data from our practice shows a 52.8% live birth rate for couples who complete 12 cycles of treatment. We can expect 32.1% of couples with previous IVF to have a live birth and 80.6% for those with 3 or more previous miscarriages. These are average percentages for our practice population. Your individual chances may be better or worse depending on your age and history. Your Neo Fertility doctor will give you an estimate of your percentage chance at your first medical consultation. Over 97% of couples conceiving have a singleton pregnancy in our clinic. We have a high incidence of full-term, normal weight babies compared to IVF. 1 baby at a time is safer, resulting in a healthy pregnancy for both mum and baby. For family planning, we estimate Neo Fertility will be greater than 97% reliable to avoid pregnancy, especially for couples who attend a Neo Advisor for teaching sessions. Although our system is based on well-researched methods of fertility awareness, Neo Fertility is new and our numbers are not yet currently available. Anatomy and Physiology Overview. A little bit about male fertility. Healthy sperm are essential for optimum fertility. Men have a constant sperm production and do not have a fertility cycle like females. 40% of subfertile couples have a male factor contributing to subfertility. We have treatment strategies for men that may improve sperm quality for up to 50% of those we treat. We commonly see improved count, motility, and DFI, DNA Fragility Index results. Neo Fertility is not an option for persistent azoospermia when no sperm are found in the semen sample. Women have a fertility cycle. Conception is only possible for 5 to 6 days each cycle. If you understand your signs of fertility, you will know when conception is possible. It begins in the brain. The brain is responsible for the cascade of hormones at the start of each cycle. When you experience increased levels of stress from work or illness, extreme dieting or exercise, and emotional turmoil, this will impair or delay ovulation. Female anatomy. This is a diagram of the uterus or womb. There are 2 fallopian tubes, one on the right and one on the left. They can collect an ovum or egg released from one of the ovaries each month. The cervix produces fertile mucus, which passes through the vagina and is discharged externally to cause a wet feeling or visible mucus which the woman can observe and record. Let's look at the monthly changes in the ovary in more detail. We will start with menstruation, day 1 of the cycle. For most of this week, the ovary is quiet. After about 7 or 8 days, several follicles begin to develop. One becomes mature or dominant. By about day 14 of the cycle, this 2 centimeter fluid-filled cyst ruptures or bursts to release the egg. Ovulation occurs in an instant, similar to a balloon bursting. The remnant of the follicle forms a corpus luteum, which makes both progesterone and estrogen in the second half of the cycle. If the egg is not fertilized, the corpus luteum shrinks and disappears, so a new cycle can begin all over again. What do we need for conception? Good egg, good sperm, and good mucus. The ovum or egg lives for about 24 hours at most after it is released by ovulation. Mucus flowing from the cervix allows sperm to survive 3 to 5 days. Mucus is essential for sperm to enter the uterus. Fertilization occurs in the outer part or ampulla of the fallopian tube. The sex of your baby is determined at fertilization. The embryo travels along the fallopian tube to the uterus and implants 7 to 8 days after ovulation. Key indicators from your fertility cycle allow you to know when is the best time to either achieve or avoid pregnancy. You look for wet feeling, visible mucus, and, if you wish, temperature rise. Let's see how the fertility chart reflects changes that occur in the ovary. The bleeding days tell us the ovary is quiet and preparing for a new cycle. Immediately after the bleed, you feel dry while walking and no mucus is seen. After a few days, you may notice a wet feeling while walking even before mucus is visible. This is the beginning of the fertile phase, and it tells us estrogen is being produced by developing follicles. Mucus begins as a small amount of cloudy discharge with a short stretch. When the follicle is mature and about to rupture, mucus is usually more abundant, clear, and slippery. The peak day, or presumed ovulation, is the last day of any one of the following: clear color, stretchy mucus, slippery or wet feeling. After peak, we count 3 days. You feel dry again and mucus has disappeared, which tells us the fertile time has passed. Recording basal body temperature can provide further confirmation that ovulation has passed. Progesterone coming from the corpus luteum raises the core body temperature by at least 0.2 degrees Celsius compared to the previous 6 readings. A persistent elevated temperature late in the luteal phase can indicate pregnancy very early. A drop in temperature indicates you are not pregnant. This is an example of a plotted temperature chart. We provide paper graphs, or if you prefer, you can keep a record through the NeoFertility app. Observing and charting your fertility. You may use our paper charting booklet or the NeoFertility app. Either way, we want you to follow the same assessment and recording routine. The advantage of the app is it will automatically select the stamp based on your recorded descriptions and will identify the peak day for you. We will cover paper recording in this presentation. Record the date, the stamp, and the fertility code. If you wish, you may also record morning temperature based on what you observed that day. Observe and record every day. record the most fertile sign of the day, and record by the end of the day before sleeping. Ideally, the woman observes and the man records. This fosters greater communication for the couple. Here is a summary of all the fertility codes we use. Let's look at each of them in more detail. Day 1 of every cycle is the first day of proper menstrual flow. Codes are obvious according to the intensity of bleeding. In addition, it is useful to record intensity of period pain out of 10, or if you have altered bowel habit during menstruation. These codes are available at the back of your chart. Dry days occur both after menstrual bleeding and again after ovulation. At this time, you feel dry and the tissue has no mucus on it. Use a green stamp and the appropriate code, depending on the appearance of the tissue when you routinely use the toilet. If the tissue looks wet, but you do not have a wet feeling while walking, use a green stamp and the code W. If you have a wet feeling while walking, record this with a bright blue stamp and F. Sometimes this may be present even before mucus is visible on the tissue and it is fertile. Mucus starts as a small amount of cloudy discharge with a short stretch, less than 2 centimeters. Short, cloudy mucus is recorded as 1 with the Neo Fertility code. As estrogen rises, mucus becomes more abundant, stretchy, clear, and slippery. The peak day is the last day of any mucus with even one of the qualities, long stretch, or clear color, or slippery sensation, or wet feeling. Any one of these is peak quality. The app will pick your peak automatically, but with paper, you really need to know this. Use light blue stickers for 3 days after the peak day and mark 1, 2, and 3. The day of ovulation, or peak day, is variable. Typical ovulation is day 14 of the cycle, but only 15% of women actually ovulate on day 14. The number of days after ovulation is relatively constant, on average 13 days plus or minus 1. Women with short cycles usually have an early ovulation. Long cycles usually occur because of late ovulation. How to observe. NeoFertility is only as good as the data you provide. The WWIT assessment routine makes it easy to get reliable data so we can identify the fertile and infertile phases of your cycle. Walking. What sensation did you have while walking? Wiping. What did you notice when wiping with tissue? Inspect. What did you see on the tissue? And finally, test for stretch and color of mucus. Let's look at each point in more detail. Walking sensation. You are encouraged to simply become aware of the vulvar sensation noticed when walking during the day. The vulva is the outer part of the female genitals, circled in this diagram. During the bleeding days, there is usually a wet feeling while walking. When the bleed is finished, you commonly feel dry for a few days. As fertility approaches, the wet feeling returns and may even be noticeable in advance of mucus flow. At ovulation, you may feel a slippery sensation when walking. Wet feeling and slippery are fertile and are recorded with a blue stamp. Wiping sensation. When you routinely use the toilet, wipe before and after urination or a bowel movement. Wipe from front to back with a flat tissue. Make sure to wipe over the perineum, the area of skin below the vagina, as that is where sensation of wiping is felt. Dry and smooth feeling are not fertile. If there is an obvious slippery runaway feeling when wiping, that is fertile and recorded with a blue stamp. Inspect tissue. Record what you see on the tissue. If there is mucus or any discharge, lift it up to test. Test mucus. Stretch the mucus between your thumb and index finger. How far does it stretch? Short is less than 2 centimeters and long is above 2 centimeters. If any part of the mucus is clear right through, record as clear. If not clear, record that. Here is a short summary of the WWIT assessment routine. Simply make sure to take note of vulvar sensation while walking throughout the day. Wipe every time before and after urination or a bowel movement. When you wipe, take note of the sensation. Inspect the tissue and test mucus for stretch and colour. Do remember to bear down at the end of every day and always check after a bowel movement. It takes at least 21 days to develop a new habit. I recommend the Neo Fertility Habit Helper to help develop your new assessment routine. It is highly recommended that you learn how to record your cycle with our user manual and teaching sessions with a trained Neo advisor. Advisors are available through NeoFertility.ie. Temperature shift to confirm ovulation. The advantages of taking your temperature first thing every morning when you wake is you can confirm ovulation has passed. Detect pregnancy early, 14 days after the peak, when the temperature does not fall as expected. You may record your temperature with a conventional oral thermometer or use a more advanced device such as the Temp-Drop sensor. Advantages of the oral thermometer include a lower cost of about €25. It is easy to get one, and there is a lot of experience with the thermometer. Disadvantages include you have to wake at the same time every morning, including weekends and holidays. You have to do it first thing when you wake before you get out of bed, and you must sit for 2 to 3 minutes to record your temperature. The reading is unreliable if you had broken sleep, too much alcohol, illness, or if you have overslept. Advantages of the Temp-Drop sensor are there is no need for morning recordings, there is no need to sit and wait for 2 to 3 minutes each morning, there is less chance of user error, and the temperature is recorded automatically while you sleep. You can get a good reading even with broken sleep. Disadvantages include cost. It is more expensive, about €150. You need a smartphone to use it, and you need some minimal technical ability. An algorithm is used to adjust readings and identify the temperature shift. There is less clinical or published experience with the sensor compared to oral thermometer use. Either way, our goal is to identify the thermal shift to confirm ovulation, primarily indicated by the mucus change. Again, ovulation has passed when we have 3 readings 0.2 degrees Celsius above the previous 6 readings. It is presumed ovulation occurred the day before the temperature rise, but this may vary. Follicle rupture or ovulation is usually on the peak day, but may occur up to 3 days before or 3 days after the peak. Family planning to avoid pregnancy. We expect greater than 97% reliability for avoiding pregnancy with our system. Days of infertility are the bleeding days, if there is no mucus, and the dry days before mucus appears. You are fertile from the beginning of any wet feeling or visible mucus until 3 full days after the peak. Infertility has returned on the 4th night after peak mucus or the 3rd night after the temperature rise, whichever one comes last. Other charting concepts. Under other indicators, you can record a positive ovulation test as shown. We can also record days of pain, fatigue, low mood, and more, using the codes from the back of the chart. You can keep a record of any medications and vitamins you have taken using the codes provided. Record all days of intercourse with an I. Record I with a line through it if intercourse was attempted but not successful. Treatment plan for infertility and miscarriage. There are 3 phases of the treatment plan. Phase 1, assessment. This typically takes 2 months to complete. Phase 2, balancing. This also takes about 2 additional months to achieve a balanced, healthy cycle. Phase 3, allow conception. This can take anywhere from 1 to 12 cycles, while we wait for a pregnancy to occur under the best conditions we can provide. Let's look at Phase 1 assessment in a bit more detail. During this time, you begin charting. You work with your Neo Fertility advisor to ensure complete and accurate recording. You have blood tests taken on day 3 of your cycle for 1 month only, and every month we look for a blood test to assess progesterone and estradiol 7 days after the peak day. We get a whole range of blood tests on day 3 as listed, but remember, this is just for 1 cycle. Every month, we recommend a blood test on day 7 after peak, or anywhere between days 6 to 9 after peak to assess the quality of ovulation. This is a new concept and completely different from a simple day 21 progesterone test. Your fertility charting pattern can tell us a lot about your baseline fertility status. Not only can we identify the best time to conceive, but we can also see if your cycle appears normal or may have signs that suggest polycystic ovaries. We can also see if you may be at increased risk of miscarriage. We can identify reduced mucus flow and abnormal bleeding patterns. In these examples, we see a suggestion of a low-grade infection on line 2, suboptimal progesterone is suggested from line 3, and possibly an endometrial polyp is suggested from the pattern on line 4. Phase 2, balancing, where we try to fix the problems we identify. We apply a wide range of medical and surgical treatments to restore balance to your cycle. If one treatment is not effective, we try another until a healthy pattern is restored. During Phase 3, while you allow conception to occur, you are encouraged to enjoy life and maintain a balanced cycle with ongoing treatment. Remember to have a monthly blood test on peak +7 to check your progesterone and estradiol levels. We recommend the usual lifestyle factors, including less alcohol and caffeine, with more sleep and exercise, and stress reduction. Thank you for listening. I wish you every success on your fertility journey, and I am confident we can help and support you along the way.